From the studios of the Department of Communication in Phillipsburg, welcome to Prime Minister Talks with Honorable Prime Minister Silveria Jacobs.
I am Silveria Jacobs, and today you're looking at the 31st episode of Prime Minister Talks, our last one for this year. I would like to welcome our guest, the head of the CPS, epidemiologist Ava Lista de Weaver, who has been our guest before, but seeing that this is the last episode for the year, I felt it important, seeing that we are in this special time of the holidays and the threat of a rise in cases, to have her come on and explain certain key points that the public should know. Ava, welcome to Prime Minister Talks, and I hope we can continue to have this great relationship into 2021.
Absolutely. Thank you so much. It's been a pleasure, and I'm happy and pleased that you've invited CPS back to end the year with some messages that I would like to convey to the public. And I'm always grateful for the opportunity, and I'm thankful again for having us on to convey our public health messages.
Yes, it's always my pleasure. And I actually have to apologize to the public because we didn't have any for like 2 weeks. The schedule has been crazy hectic, and of course the holidays played a role. So I really want to thank you for being here. Can you please go into, I know in our last press briefing, there was a lot of questions related to the current cases, and I had to explain about the lack of testing during the holiday period, which could affect the number. It could appear to go down, and admonishing the people not to get complacent, thanks to, of course, your notes. But I want you now, from your own voice, to express that to the people of St. Martin. Explain the active cases and where we are, as well as CPS's expectations.
Great. So thank you for that question. I think before I go into the answer to this question, what I would like to explain is what we mean by the term active cases. So for us, active cases is a reflection of the current caseload that the team is managing currently at CPS. So this figure is calculated using the total number of cases over the course of the outbreak, minus the total number of recovered persons and deaths. So for example, yesterday, our active cases was 87. But I think what's more important to understand is that this number is fluid. So in the sense that as persons recover, this number will decrease. And as persons are confirmed, this number increases. And, I've always said this over the course of the year, is that I think people have become fixated on this number. But for us, from a public health perspective and an epi perspective, what's more valuable is looking at our incidence rate. So the incidence rate is an important metric because it describes how quickly the disease is occurring in our population. So I believe maybe last week or the week before, when we looked at our number of new cases, the incidence rate was over 200 per 100,000. And when we look at our incidence rate now, using the rough estimates from our population, we see that our count now is about 100 new cases per 100,000 per week. So, on the one hand, this is a good news story, but on the other hand, again, it's to make sure that persons understand that even though these numbers fluctuate, it's important that they really take on the responsibility of ensuring that they do their part to make sure that they are taking on the public health measures. So that is, socially distancing, wearing your mask when you're in public, and increasing your hand hygiene. But, in a nutshell, I wanted to elaborate a little bit because I think people, they see the numbers one day being 80, jumping to 100, jumping to 120. And so, yes, it is important to keep in mind, but it's not solely the number that we focus on from a public health lens.
Yes, I think even, sometimes they were also making a lot of noise because some really look forward to the long list of data and others were totally confused by it. And I think it's important that they understand that they can always go to the website to see the full data of all that CPS is monitoring, but that for simplicity's sake, we only put out with the short amounts, the smaller amounts of information. And that per 100,000 It does not mean we have 100 cases a day or a week.
Correct.
Because we do not have 100,000. The number is calculated as a ratio.
Exactly.
And for people who are not mathematical, that can create confusion. So this is why we don't say these kind of things.
Absolutely. And I think
of course,
even yes,
sorry,
exactly. And I think
you are the ones.
Exactly. And to your point, another metric for us is when we look at the incident number. So that is the new cases per day. That also allows us to gauge our response and how we adjust in-house to increasing and staffing up when we need to respond to 20 cases a day or 25 cases a day. But all that to say that, as numbers increase, resources at CPS need to be up to a certain standard to be able to react and contain the further spread.
Wow, I know you've had a tough time, and I really wish we could award you and each of your nurses, give a huge plaque. I know we were finally able to do some compensation for the overtime when it was really, really, really rough. And yes. I knew you felt underappreciated. So I want to really take this time to tell all your nurses, all your administration, your back office, your EPs that came in from abroad, and other assistants that you've gotten, a great big thank you on behalf of the people of St. Martin. And this is why I found it important to bring you here also, because what I read in your EPI report, all the graphs, I love graphs, all of that speak to me. But the fact that if it continues, the incidence, the number of infections per day continue to increase, it will really challenge CPS to be able to do the proper contact tracing and all that is needed to ensure that we are tracking everybody.
Exactly.
All right.
And, I just want to elaborate on that point is that, right now, given the incidence cases that we are seeing per day, we are still managing, but we need to also factor in that, as cases continue to increase, I've always said, this calculation that good source and contact tracing takes 8 hours for one case. And so, the team is meticulous and we make sure that we are thorough. And this becomes important if we get, 40 cases a day. Just think about the manpower and the hours that need to go into that to make sure that we are on top of our source and contact tracing.
Thank you so much, Ava. I want to take this time. We're going to need to take a break in a few seconds to thank you again and ask the general public to continue to tune in. We're going to be right back after this short break with more information on how we can keep our numbers down.
Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs.
Every day at the Civil Registry Department, we are confronted with at least one customer who did not pay attention to the expiration date of their passport, such as the Lockharts. To avoid this from happening to you and your family, we urge you to check the validity of your passport. If your passport is about to expire, please follow these simple steps to make an appointment. Visit appointments.stmartingov.org and follow the easy steps. All applicants must apply in person, last issued Dutch passport, 2 recent photos taken within 6 months. Minors must be present with legal guardians. Fee for adults, 210 guilders. Fee for minors, 150 guilders. Additional information can be requested. 4 weeks processing time. Your identity is your responsibility.
Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs.
Welcome back to Prime Minister Talks. I'm Sylvaria Jacobs, and today our guest is none other than CPS head Ava Lista de Weaver. Let's call her our Woman of the Year in terms of being bogged down with work. And I wanted to have her here for the last segment for this year, 2020, our year of challenges, pandemic. First time in our lifetimes, and I think we've done a pretty good job regardless to all the challenges we faced. Ava, we ended off talking a bit about ensuring that we are doing what we need to do, and what it actually costs CPS and how we do the incidences and make our calculations. But something that also comes out in our EPI report is the clusters. And I would really like you to explain to people what clusters mean, and when that happens, what are then the steps that CPS takes or recommends for the place that has a cluster?
No, absolutely. So over the course of the epidemic on St. Martin, source and contact tracing has allowed us to piece together where certain persons could have become infected with COVID-19. So it was at this point, I think the public was aware of the term that we use in outbreak investigation called a cluster. And so a cluster by definition is an unusual aggregation of health events. So in this case, 3 or more cases that are grouped together in time and space. And so when we look at our data through our in-depth source and contact tracing, in the summer, it was clear that our resurgence of cases that we saw was directly attributed to the nightlife sector. And I say this not to intentionally target a particular sector, but this was what our data demonstrated at the time. And when I look at the current epidemic now, it's clear that our clusters are occurring across various sectors. So that is supportive of what we're seeing, community transmission. And I know it's been said by many that CPS doesn't have the data to support these claims, that we're fear-mongering. But on the contrary, we base our decisions and our advice and our public reports on the data that we are gathering by each individual case. And so our interventions that we have put forward, based on what we're seeing in these clusters, are based on our data. They're based on international evidence, and they're adapted to our local context. So I will say right now, we are currently managing 10 active clusters. And this, to be honest, is across the community, across various sectors. We are seeing clusters in households. We are seeing clusters in the marine industry, in the medical sector, in the restaurant sector, in the justice sector, in various office spaces. And for me, what that is an indication of is that persons aren't necessarily adhering to the public health measures. I've said this time and time again. I know it's hard to wear a mask when you're at work among your colleagues, but this is the tried and true way to prevent transmission. We say wear a mask because there is science that backs the fact that we're saying to wear a mask. There is a reason behind that. It's not to say that we want to inconvenience somebody. And so what we are seeing when we do these investigations with these clusters is that, 1 or 2 persons are exposed at work. They're not maintaining the public health measures. They're in turn going home to their families, interacting with their families, a cluster brews in their household, and it just continues. So unless we break that chain of transmission, so to speak, and really reinforce the public health measures, we will continue to see clusters. We will continue to see community transmission. And so, again, I'm not trying to target one sector. When we identify clusters, it's a testament to how meticulous we are when we're doing our source and contact tracing.
All right, so your suggestion for people in the workplace and people at home, and especially now during the holidays, because the holidays pose a threat because there'll be more mingling on a social level.
Absolutely.
So what suggestion can you give to people that we can prevent the spread even during these holidays?
So to be honest, I know I probably sound like a broken record, but I will say wearing your mask in public spaces. I know that, I even have family that have come to visit for the holidays, and I make sure that we wear our masks, we maintain our distance. If I have to socialize, I'm doing it responsibly. I'm outdoor. I'm not, involving myself with tons of family members all at once. We have to do our part to minimize that interaction, and to make sure that you are wearing your mask. If I can't I always joke sometimes and say I'm not the COVID police, and I won't, pop out and tell you don't socialize, but you have to do it responsibly. So if you choose to put yourself in those settings where you are exposing yourself at higher risk of acquiring COVID-19, all I can ask is that you wear your mask and you be responsible with the way that you conduct yourself publicly. So, that's sort of been my message for the past months, but it is imperative. I cannot force somebody to control their behavior. They have to do it upon themselves. I advise my minister, I've advised the Council of Ministers to take certain measures, and I will still stand by the 3 that we've said: wear your mask, keep your distance, and wash your hands.
Right. And I must say that I feel like I'm the COVID police as well. I walk into a restaurant and scramble for their masks.
Yes.
It's sometimes embarrassing. I'm like, I shouldn't have to be the one that causes people to quote unquote behave. I wear my mask all the time. I take it off to eat. I take it off to drink. But I had a perfect example the other day, and I'm getting a bit personal, where I had people over to my house. We were 9 of us, including my family members, so 6 persons coming into my house, and everyone wore a mask. We did painting together. The instructor gave instructions, and there's my product
very
on the
nice.
wall. We all painted. But, I'm really proud of it, so I'm showing it off. But I'm trying to say that even in a family setting, because the majority of the members that took part in it were family members, you can wear a mask, you can remove it, have a drink, and put it back on. Yeah. And I think that's the most safe way to socialize. I know there are many parties organized for years, and that's why I definitely wanted this to air today. Get a pretty mask, get a special mask, bling out your mask, do what you have to do if you're going out tonight, but make sure you keep a social distance from people who are not in your immediate family circle, because that is how it will spread. And I'm going to take a break just now, but when we come back, Ava, I really want you to explain what the threat is if our numbers jump crazy between now and the next 2 weeks, which is when you would expect a change, a rise in cases due to, let's say, Christmas up until now. Yeah. So we're actually been looking that it's gone down a bit, even with the delay in testing. So we're going to keep our fingers crossed that our people continue to be very vigilant and look forward to the numbers not rising over much that you are taxed. So after this, we'll have a short break, enjoy my painting, and maybe we'll be able to organize some as a rest and recreation for others. Until we get back, this is Prime Minister Talks.
Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs. Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs.
Welcome back to Prime Minister Talks. I'm Sylvaria Jacobs, and I'm here with epidemiologist, CPS head, Ava Lista de Weaver. We went off a little bit on the personal side, but I think it's important for the general public to understand that we understand it's been crazy not being able to see family, not being able to socialize as normal. But if we do so in a responsible manner, I've been saying move smart if you must move. So responsible, smart, and be protective of yourself as well as your own family. Then at home, when you're home with just your immediate family, you can be without masks. But if you're out there willy-nilly, then you're going to have to wear a mask at home to protect your family. That's how I look at it. So be smart about it. And hopefully that will not overtax our hard workers at CPS any more than they have been for 2020. We're looking forward to vaccination strategy. I've heard that the Dutch Kingdom is working on that. The Netherlands is talking about rolling out in the first week of January. Our EPI report said in the first quarter. I think that's a bit vague. The people continue to ask questions about that. Can you be a little more specific in terms of St. Martin's vaccination strategy?
No, absolutely. So as you mentioned, we have received indication that we will be getting some of the vaccines, and unfortunately, a lot is still up in the air. And that's not to say, I wouldn't want to commit publicly to say, yes, it's coming in January, and then lo and behold, we have barriers that we have to overcome. What I can say, though, is that they have already secured some of the equipment needed to store the vaccines. So right now, while we don't know the exact brands and the exact quantities of the vaccines that we will be getting, what I can say is that we've limited it down to the Pfizer and Moderna vaccines. So both of which are already being distributed in various countries in North America and Europe. While I guess I say the first quarter of the year, because a lot needs to happen before we can actually implement the vaccine strategy and start vaccinating the public. So one of the things, I believe last week or the week before, they have already shipped the equipment that we need to store these 2 vaccines. Of course, with vaccines, we have to also consider things such as the cold chain. So the term cold chain is used to describe the conditions under which the vaccine has to be stored. So from the time it leaves, let's say, the Netherlands, to the time it is at the public health department for distribution and administration, we have to make sure that we maintain that level and the integrity of the vaccine. So, it's these equipment that we will be receiving are adequate to store the vaccines. There's different temperatures that need to be stored for both vaccines. And so the Netherlands has ensured that the Dutch Caribbean islands will have the equipment needed to be able to take on the vaccine, whether it's Pfizer or Moderna. And then in terms of the vaccine strategy, what CPS and the Public Health Department have been working on is developing this strategy, which is, I'd say, in the final stages, but it is an all-encompassing document. So regardless of any intervention that comes into play, a new vaccine being one of them, we have to ensure that the public health has the logistics and the staffing, the manpower to actually execute and implement vaccines. So for us, what we have put together in this implementation plan, among other things, is once we have the vaccine equipment, we need to make sure that we have proper procedures to monitor that the storage is, that the temperatures are actually being maintained. We have to ensure that we have a plan for how we're going to administer the vaccines, who we're going to administer the vaccines to. One of my roles in particular is working with a working group to define our priority groups. One of the questions I think that the public wants to know is who will be first to get these vaccines? And so much like the other countries in the world have done, they have prioritized healthcare workers, frontline workers, and the elderly. I know personally, when I was involved with H1N1 vaccine implementation, we also looked at priority groups. And so at that time, it was the both extremes. It was the elderly and the young. And COVID-19, I think, is no exception. So we have to look at, using the evidence that we have, having conversations with the GPs, with the hospital partners, with healthcare partners to see, should we also focus on our frontline workers? Should we also focus on the elderly? Because these are the vulnerable populations that we are seeing even on St. Martin. So, the vaccine strategy has many components. I will say one big component for us as well is looking at our communication. So how are we informing the public? Are we creating FAQs? Are we, sensitizing and preparing the public to be receptive to vaccines? And on a side note, what I can say is that CPS, SNB, and DCOM partnered together about 3 weeks ago to develop a public survey. And the intention is to use that information gathered from this survey to adapt our communication strategy for vaccinations in particular, because we want to make sure, if our public is skeptical or if they're a bit weary of the vaccine, what do we need to do from a public health stakeholder, from a public health perspective, to make sure that they feel comfortable with the knowledge that they have about the vaccines that we're getting. So all that to say that the implementation plan and the strategy is multifaceted, but there are certain components that we are prioritizing, such as the communication strategy, such as the priority groups, to be able to be ready for execution when the vaccines do come to the island.
Yes, we are down to like 1 minute, and I still had one more question. I think you're going to have to save that one. It really was like your goal for the new year, but it is so, you won't have enough time to go into that. So I really, really want to thank you, Ava. You've given a whole lot of information. You've become really comfortable on camera doing these things. So I must say there's been growth in that over the year. I'm hoping that the people of St. Martin have been well enlightened as to all the information you just brought forth, elucidating further what was said in our press briefing this week, as well as last week. And you also held a press conference with your minister. And I really want to commend CPS for everything that you've been doing. Do convey to each and every one of the workers that are responsible for the contact tracing and all the back office work for what you're doing and continue to do. I know you've hired some local nurses as well, and I hope that you can continue to find more local resources so that we can maintain and keep St. Martin healthy. To the people of St. Martin, stay safe. It is the holiday time, but if you have to move, as Ava says, our EPI, our professional, move responsibly. I, as PM, say move smart. Keep it simple, wear your mask, wash your hands, and don't go into large gatherings. Have a safe ending of 2020. And until we see each other again in 2021, this has been 31st episode of Prime Minister Talks. Stay safe, St. Martin.